We are celebrating, dear viewers, today we are celebrating Pre-Diabetics Day. The Pre-Diabetes Day, that is today 14th of August, we are celebrating, that is before our Independence Day. So on this occasion, Pre-Diabetes Day, we have to change our lifestyle according to our needs. What do you mean by pre-diabetes day? Pre-diabetes day is a condition where the sugars tend to rise, but they are not established diabetes. So before it will take time, any diabetic condition, before its diagnosis, the symptoms may be there, may not be there, but the sugars are starting rising. First, fasting blood sugar goes start rising. After that, followed by post-lunch sugar. So, in these conditions, generally we will see after the age of 45 years, obese people or some ill health or any family history, these people are tend to have this pre-diabetes. So, pre-diabetes is a condition where with this condition we should be more alert. And metabolic syndrome, where pre-diabetes is the earliest component. So, in this thing, if you will take care from this stage onwards, we can reverse the diabetic condition. Our sugars will become back to the normal. And mainly, we are interfere with the lifestyle of the particular individual, and the patients will start doing exercise and changing their dietary habits. These things will be common. So the pre-diabetes, when we are diagnosing, so that means the sugar, we have to test the fasting blood sugar and post-lunch blood sugar and HbA1c. So if the fasting blood sugar is more than 110 or 120 up to 140, and we can say 120 itself, 110 to 120 we can call it as a pre-diabetic condition. If it crosses more than 124, we can establish diabetes. So this is 110 to 124 is the stage where pre-diabetes is established. But in this condition, we need not to give any medication. We have to change the diet, especially in the night, that because it's the fasting sugar style to rise. In the post-lunch sugar, if it is more than 142, 199, we can call it as a post-lunch hyperglycemia or impaired glucose tolerance. This impaired glucose tolerance, where we are generally seeing in this pre-diabetic condition, there we have to interfere in their lifestyle. What do you mean by lifestyle? Lifestyle includes both exercise and diet. So, in the exercise part, every individual after 40 years better to walk, run, or cycling, or depends on their stamina, they have to do more exercise. And minimum 1 hour they have to do. Then only the insulin resistance will come down. If the patient is overweight or obese, this exercise should be done extra, and they have to do more vigorous exercise. And next thing is about diet. In the diet especially, we have to reduce carbohydrate diet. So better to reduce the simple sugars and sweets, and also increases the fiber in the diet. So even though we are taking carbohydrate, if we are mixed with the fiber, the glycemic index will come down, by which the sugars may not rise. So these post-lunch sugars, generally they are caused by this, and these post-lunch sugars will be reduced. So these fasting and post-lunch, they tend to rise even after in this situation, pre-diabetic condition, and we have to focus on diet and exercise. In the diet, we have to reduce the carbohydrate, especially simple sugars and sweets. We have to control or stop taking. And better to take mixed carbohydrates and fiber-containing carbohydrates. That too, the ratio of carbohydrates will be less than 40%. The protein content and fat content, we can increase it. So the the ratio of our regular nutrition, because we Indians are having this tend to rise in pre-diabetic condition more in early age, below 30 years also, 30 to 40 years. So if we have to be careful and we have to change the lifestyle, especially our dietary phenomenon stage, dietary products. So this diet will be controlled within the because diet is calculated according to the calories. So these calories, generally the fast calories are simple sugars and slow calories are complex sugars. So when we are taking complex sugars, the glycemic index automatically will reduce. If the simple sugars, if you are taking more, even the quantity is more, but the glycemic index will be more increased. So this thing you have to bear in mind before giving any special diet. So always better to have less carbohydrate diet, more exercise than 1 hour. That is the mantram of pre-diabetes. So we have to be careful, and we should be careful from the line, especially pre-genetically involved or any family members are involved with the diabetes. The offspring should be follow this type of this thing, and they have to be take care of about the pre-diabetes, and they start doing exercise early age and taking less carbohydrate food. That is the principle behind it. Thank you.